a look at the sternum. So of course the sternum is the most anterior, midline, mid-sagittal part of the whole rib cage complex. Now when we look at it, we can actually see the sternum has three different areas. We have almost a quite sort of a triangular piece up here. We have this long piece down here, and we got this little projection down here. And all three of these have different names. So let's have a look. So up here, above that line right there, this whole area bone is the manubrium. So that is the manubrium. Down here is the body of the sternum, and down here would be the xiphoid process. So as we look at the sternum, you can see that it interacts with a number of things. What we're seeing here are the cartilage connections between the sternum and the associated ribs. Now, there are some little bumps up here. So you see right here, that area right there, we'll try and get in close for you. That is the jugular notch. And right next to the jugular notch, we got an area which is basically the clavicular notch. So the clavicles, remember the clavicles interact with this bone. Now, this is the articulation right here, the articulation with rib number 1, 2, 3, and all the way down. Now, there's another really important feature right here. This is the sternal angle. And when I turn it to the side, and if you look carefully, you can see that the body of the sternum goes up, but once I get to the sternal angle, it's called the sternal angle because the manubrium is sort of goes backwards at that point. It's leaning posteriorly. So that is the sternal angle. Now this is a really important landmark potentially because sometimes you want to listen inside the chest between certain ribs to hear certain parts of the lungs, different lobes of the lungs, or maybe different parts of the heart. And you want to do that often based upon being between certain ribs to listen. And it's very difficult to count the ribs if you start at rib number 1 because it's buried beneath so much tissue. But the sternal angle is a good landmark for rib pair number 2. And you can feel this on almost everyone, that if you start up here at the jugular notch and you work your way down, and it doesn't matter young, old, most people you can feel this on, you work your way down, you can feel that you're on the manubrium, and then all of a sudden you will feel this horizontal ridge, and that is the sternal angle, and that is a dead giveaway that you are at rib pair number 2. So those are the main parts. We have the manubrium, we have the body, we have the xiphoid, we have the jugular notch. There are notches where the clavicle attaches, and then we have the attachment points for the various ribs, and we have the sternal angle, which is a great way to landmark for ribs.